Hello guys, welcome to the channel Health Tricks and Tips in English, the best pregnancy centric channel. In this video, we are going to discuss about vomiting during pregnancy. This vomiting is generally seen in the first trimester of pregnancy. The vomiting, or you can say morning sickness and nausea. So these are the very common problem of first trimester. And this problem of nausea and morning sickness and vomiting normally go when you land up in your second trimester of pregnancy. But if you are still facing this problem of vomiting in your second trimester and even in your third trimester, then this is a matter of concern. Let us understand why does vomiting occur during pregnancy. See, vomiting during pregnancy is a very common symptom of getting pregnant. It also indicates that your pregnancy is going forward smoothly. The necessary hormones in your body are building up, and that is why you are facing this problem of vomiting. Generally, this problem of vomiting is caused by a hormone that is known as GDF15. The full form is growth differentiation factor 15 hormone. And due to this hormone, women struggle a lot with the problem of morning sickness, vomiting, and nausea. Apart from this, you can also suffer due to other reasons as well, like heartburn, acidity. If you are facing any problem with your digestion or constipation, you can face this problem of vomiting. If you are having acidity, the acid is producing in your stomach starts coming towards your food pipe, that is the esophagus. So this can be accompanied with heartburn as well as you can feel vomiting. Another reason for this vomiting is due to the increased blood pressure during pregnancy. When during pregnancy this blood pressure is increased to the higher limit, the problem like preeclampsia can come to you. It is a quite complex problem which would definitely need medical attention. Due to preeclampsia, there can be problems like preterm delivery, preterm labor, and in some cases miscarriages as well. So this problem of high blood pressure and resulting into preeclampsia can impact the baby inside the womb in some wrong ways. So these are 2-3 reasons why vomiting can happen to you. If it is happening in the first trimester, it is quite normal, and after the first trimester, it should go away. It is a big sign of a healthy pregnancy, but if this problem is carried towards your 4th month and onwards, then this is a matter of concern. Now we will look into some home remedies that you can opt to reduce this problem of vomiting. You have to make it very sure that whensoever you are getting up in the morning from your bed, you should not get up without eating something, and that something would be soaked raisins, soaked almonds, and walnut. You can take handful of all these, soak it into the water overnight, and then you can eat it first thing in the morning. This you should be eating because you should not get out of the bed in the morning without eating anything. If you are going to the kitchen, try to avoid it in the early hours of the morning, because in the early hour of the morning, the sensitivity, the smell from the kitchen area is more profound, and it can impact this problem of vomiting, nausea, and morning sickness more. So this is the first thing you should be keeping in your mind. Now the second thing you can go for is the lemon water. To prepare the lemon water, you can take 1 glassful of warm water, take half a lemon, squeeze it in the water, add a pinchful of black salt and pinchful of cumin powder. Mix it well and drink this juice. You can drink it anytime you are feeling vomiting or after vomiting. If you are drinking it, this problem of vomiting, morning sickness, and nausea will not come to you. You can drink it in early hours of the morning. It will be highly beneficial for you. Apart from this, you have to keep your body hydrated, because whenever you are vomiting, the necessary salts from your body are flushed off. And to replenish your body with all those nutrients, you should be drinking fruit juices, you should be drinking normal water. At least 8 to 10 glassful of water per day is essential for you. Also, you need to include the fruit and the fruit juices so as to nourish your body and keep the water level in control. Next thing you should understand is to not take heavy meals. Only eat home cooked food that should be prepared with less oil, less spices, and less salt. Try to avoid outside food, as well as you should not be eating the stale food. It is also one of the reasons for inviting this problem of vomiting, morning sickness, and nausea. Also make sure that you are not taking heavy meals. If you normally take 3 meals a day, try to divide it into 6 parts. That is the 6 smaller parts you should be eating throughout the day. This will ensure that you are not suffering from this problem of nausea and vomiting. Next step is to take ample of rest during pregnancy. You should not be overworking. Also, you should not be taking a lot of rest. This quite often happens that after taking any meal, you feel like sitting or relaxing. But try to avoid this thing. After taking your meal, you should be walking inside the house, in your courtyard, anywhere in your house or home. You should not be taking rest immediately after eating your meal, because if you will walk for a while, it will help in digesting your food and you will not face this problem of vomiting and nausea. Also, walking is quite important in the morning and in the evening. If you are going for at least 30 to 45 minutes of walking, it brings immense benefit for your pregnancy, for the development of the baby inside the womb, and it will also make your body flexible, your muscles flexible for the normal delivery. However, in case you are advised for the bed rest by a doctor, you should completely avoid walking and stick to the bed rest. Next is to understand about your sleeping style and the sleeping pattern. In a day, you should be sleeping not less and more than 8 to 9 hours. This is quite enough. Lesser than this range is not good, and more than this range is also not good. So this 8 to 9 hours you have to sleep throughout the day. If you're sleeping in the daytime, only 1 or 2 hours would be enough. Rest you can sleep at night. The sleeping position also matters a lot. You should be sleeping by your right hand side or the left hand side. The left hand side being more beneficial for the digestion and for the supply of nutrients and the blood to the baby inside the womb for the proper growth and development. So in this way, if you are sleeping, you will get the sound sleep. When you will get up, you will not feel nauseated, and the problem of vomiting and morning sickness will be reduced highly. So these were the tips you can follow, and you will see that this problem of morning sickness, nausea and vomiting will go away. In case this problem is becoming severe, you should not delay in seeing your gynecologist. If you have found this video helpful, kindly press the like button. If you are coming to the channel first time, consider subscribing us on YouTube, following us on Facebook and Instagram. We'll connect in another useful video on pregnancy. Till then, peace out, stay happy, stay healthy.